A lot of the problem with MS is the unpredictability. And have you thought about that, or does that influence your life or weigh on you in some way?
Certainly. I mean, I think that I was diagnosed with MS right after I got married. And so we thought, oh, well, we'll get married and we'll have some babies. And I put that off for 2.5 years. I put off even opening the door to the question of having children because I was sort of waiting for what was going to happen. You know, was it going to be tomorrow? Was it going to be next month? And that began to subside after I racked up a number of months, a number of visits of no new news in the world of MS. But it really scared me, and it scared me to think about bringing a person into the world who would be dependent on me for a really long time if I was maybe not going to be able to take care of someone else in addition to myself. And I had to really cross a bridge into thinking about my life differently and having a greater degree of faith and having a greater degree of trust that when something comes, I will figure out how to deal with it then. I'm really happy with my husband and my son, and but I still, that question comes up again and again. Will we have another child? Will I switch medications? If I switch medications, will I stay on the medication, go off the medication, to have another baby or not have another baby? All of those what ifs come up quite frequently.
Bonnie, you must have had some of that waiting for the other shoe to drop
I had
feeling.
exactly the same and a similar experience. I spent a very long time waiting and wondering and sort of in what I called a holding pattern. Mm-hmm. And I probably did the most disservice to myself by looking online and researching the wrong avenues to sort of who would tell me what would happen. What saved me was seeing a psychologist and really talking about anxiety and what anxiety means, and I stopped driving. I had a 2-year-old who I was afraid to be alone with because what if? The what if gets less, and the learning to live the fullest life becomes so bigger, and that's a blessing.
So what can we do? How do we get that message out? Because we tell people all the time, just what you were saying, say, I can't make this better for you now. It's going to be scary. And every week and month that passes by and nothing happens, it becomes less and less scary. But how do we get to that earlier and earlier?
I think that the critical path to convincing, and convincing was for me that I would be okay, is literature and information out there that tells, well, we don't know, but there are good stories. Not everything is bad. Not everything do you wind up debilitated. There's a positive. I became much healthier. I eat much healthier. I take care of myself much better since this MS phenomenon, as I call it for me, and having good doctors that you can trust. And trust is also a big component. You get to that level where people don't tell you non-truths, when the I don't know. And there is a positive. And I think a lot of what we see of MS is the worst. We only see the worst. By looking at me, or looking at all three of us, you don't know we have MS. That's a message that needs to be out there.
I think Dr. Loveland and I have the privilege of working in a comprehensive MS care center. And I think we have a lot of disciplines represented here that can help people deal with MS, getting beyond just the matter of making a diagnosis and prescribing medications. We have social workers, we have nurse practitioners, we have the opportunity for people to participate in research trials. We have a bevy of research coordinators to help with that. And I think having a team that can help people and their families, because I'm sure your husbands and other significant others in your lives have had to go through the pain of the diagnosis of MS as well.